Hi everyone, my name is Dr. Chuck Lee with 7 Day Dental. I'd like to discuss regarding sleep apnea. We as dentists, we can make a big dent, help our community and help our patients, because sleep apnea is a very hot topic and has been a topic that not too many doctors know. In the CDA June 2012 issue, I remember one of the doctors said that a medical student has about 2 hours regarding sleep, the study of sleep in their course. So very little is spent on that. Yet this sleep apnea has such a detrimental effect on patients that have it. We've seen a lot of patients that we've had caused a lot of accidents where people fall asleep when they're driving. Also, we've had patients that have sleep apnea, undiagnosed sleep apnea, that have had heart attacks, diabetes, the list goes on and on. So as we as dentists, we can really help our patients by not only just looking at their teeth and their mouth for cavities and for gum disease, but we can also look to see if they have upper airway obstruction, or if they have tonsils that are too big, that may block their airway when they sleep. I want to briefly discuss what happens. What happens when we sleep? When we sleep, as you're laying back, you're relaxed, your jaw is dropped backwards, and your tongue falls backwards. Already you can see as the tongue falls backward, it's already blocking their airway. And if you have if you're a little bit overweight, you're probably going to have a bigger neck, a lot more neck fat and muscle. It collapses too and gets in the way of the airway. So what we have is, when this happens, the brain sends a message to the heart saying, heart, you got to pump faster and more to send more oxygen in the blood to all the extremities. And this, in a life and death situation, the brain will send a message to your jaw to clench down. When we clench in the forward position, and by clenching, we open up the airway muscle, okay? And it opens up the airway, allowing more oxygen in. So that's why if we see patients that have wear marks, that you can clearly see that there is a lot of clenching going on in the front or the back teeth, you should ask them 2 questions. One is, do you get headaches? And the second question you should ask is, do you snore? Or do you ever feel like you're wake up catching breath? Or you feel like you have unrefreshed sleep? Or do you feel like you're always tired because you don't feel like you even though you sleep 8-10 hours, you don't feel like you are fully yourself awake? So I hope that you can look for these signs, and what we can do is we would have to have them get the sleep test through Easy Sleep. So normally, as it is now, the patient fills out this form, the Sleep Health Questionnaire. And once they fill out these questions right here, such as, have you been told you stopped breathing while asleep? So they fill out these questions here. If they answer yes, and there's a numerical value for each of the questions, if they add up to 8 or more, Easy Sleep recommends that we send them in for a sleep test. Well, the cool thing is, nowadays you don't have to go to the sleep center. Easy Sleep will send a device to the patient's home. So So have the patient, all the patient will fill out this questionnaire, and they usually the section 1, those are the section 1. Section 2 would have signs and symptoms. A lot of them they're not going to know. They don't. They may write down such as grinding teeth, depression. They're usually not going to write those things down. So you'll probably have to ask them, hey, or if you see that they grind their teeth, you can cross out one, and snoring, they'll cross the other one. Then, after they fill this out, the doctor or the hygienist needs to go over with the patient, and this is a sleep health questionnaire prescription form. Oh, by the way, when the patient fill out the sleep health questionnaire, you want to make sure that they print so that Easy Sleep can read it clearly, and also that they put down their cell phone and also what insurance they have, if they what insurance it is. If it's a PPO, make sure they write down, and also we need a copy of their medical insurance card so that we can fax it to Easy Sleep as well. So when you go over this with the patient, all you need to know, you can check with them. You can check such as hypertension, bruxism, loud snoring, which a lot of times loud snoring and bruxism is, you can put those down. And if they have depression, GERD, regurgitation, they have diabetes, narrow or V-shaped upper arch, that you can look inside and see. If they have soft tissue that visually impairs airway, a lot of patients, if you ask them to say, ah, and if you look in their mouth and you don't see any black, that means that their anatomy is such that it blocks the airway. I'm sure you've seen, if you look down patient's mouth, when they say ah, if they say ah big and loud enough, you're supposed to see the uvula and you have to see some blackness, which means that's the airway. But there are patients that are heavy, even if you say ah real big, you're not going to see much. And that you can pretty much put down as soft tissue that visually impairs airway. Or if the neck size of male that is 17 or above, and a female greater than 16 or greater. So usually you can ask them that. And then the referral assessment, you could check this, check section 1 if the score was 8 or more. You could check section 2 if the 2 or more signs and symptoms indicated, which was from that first page. Down here, hypertension, depression, stroke, family history of snoring or sleep apnea, snoring, grinding, diabetics, acid reflux, unrefreshed sleep. Or section 3, yes to, right here, the sleep history. Have you been diagnosed with sleep disorder? Are you currently using a CPAP machine? Do you use your CPAP less than 5 times a week? Would you prefer an oral appliance? There are a lot of patients that, in the case of severe sleep apnea, the gold standard is to have a CPAP machine. However, 80% of Americans that wear a CPAP hate it. Okay, so now insurance is smart enough to know that, so they're allowing patients to have 2. They can have the CPAP and the dental appliance. They can use in conjunction because they know that a lot of patients don't like to wear a CPAP, and it's much cheaper to treat with the dental appliance or CPAP rather than wait until the patient has a heart attack or something worse, bigger magnitude, and it costs the insurance company a lot more money. So after you fill this out, all you have to do is sign. Have the doctor sign. If the hygienist, you can put my name down, just put down Dr. Chuck Lee and the date, and then send it in. So you want to send this sheet with the doctor's signature, or just write my name on it, and this sheet, which is a sleep health questionnaire, and also the medical insurance card. Now, fortunately, or unfortunately, we only accept medical PPO, such as Anthem Blue Cross, Blue Shield, PPO. We do not accept HMO Medi-Cal insurance, or Kaiser. So if the patient has the other three things, such as HMO, Kaiser, or go ahead and let them know that they'll be paying as cash. And if they don't want to pay cash for that, then what they should do is go to their medical primary care and tell their primary care that they think that they have sleep apnea because they have a lot of symptoms that have led their dentist to thinking that they may have it, so that at least they can get the test to rule out if they have sleep apnea or not. So when you mail this into Easy Sleep is going to call the patient. They'll call them on their cell phone, so make sure we have their cell phone. And once they call, they're going to confirm the address, the name, the mailing address, and they're going to let them know they're mailing it mailed to the patient. Once the patient gets it, they only need to sleep at least one night with it. It's a thing that goes over the head. It's very comfortable. Once you sleep, you push the button, it activates, and then afterwards, after one night of sleep, we will pack it, the patient repackage it, and send it back to Easy Sleep. Then Easy Sleep will download all the information, then have a sleep doctor specialist review that. And once that doctor reviews it, then the doctor will diagnose if the patient has any sleep apneic, if they are mild, moderate, or severe. Now, usually, like I said before, the severe cases, patient is required to have a CPAP machine. Okay, but a lot of patients, since they don't like that, we have them do the CPAP as well as the dental appliance. The funny thing is, I didn't know I have sleep apnea until about a year and a half ago when Dr. Burrell, I did the sleep test, and found I have moderate sleep apnea. And the funny thing, I have all the symptoms. I have the leg jerk syndrome, I grind my teeth severely, and I also snore. And ever since I have the appliance now without the appliance, I can do this. But with the appliance, I cannot do that. So I know that I don't snore anymore with the appliance in, and I feel a lot better when I sleep. I for sure, if I've gone on vacation and I forget to bring my appliance, and sometimes, I get headaches more when I wake up sometimes. And when I brush my teeth after a week without wearing an appliance, I'll have sensitivity just on the brushing on the biting surface. So I know that I clench severely, and I think I clench to survive, okay, to open my airway. So I think it's now we finally understand why most patients grind their teeth, and I hope you can help me with this campaign to diagnose patient with sleep apnea, because hopefully now we can not only help a patient save a tooth, but we're going to help our patients save their lives. Thank you so much.